A silent threat. 12 signs that could indicate depression. Depression, medically known as major depressive disorder, is a common but serious mood disorder that affects how you feel, think, and handle daily activities. It's more than just a bout of the blues. Depression causes persistent feelings of sadness, loss of interest, and can lead to a variety of emotional and physical problems. Characterized by a profound and persistent feeling of despondency and despair, depression can significantly impair an individual's ability to function at work and at home. Factors contributing to depression can include biological differences, neurotransmitter imbalances, inherited traits, hormonal changes, and life experiences like trauma or stress. It's crucial to recognize the signs of depression, as early intervention can lead to more effective treatment. Depression affects millions of people worldwide, and it's estimated that more than 17 million adults in the United States had at least one major depressive episode in a given year. Despite its prevalence, depression often goes undiagnosed and untreated, partly because symptoms can be misinterpreted as normal sadness or overlooked as a character flaw. However, understanding and recognizing the signs of depression is the first step in getting help and beginning the journey towards recovery. To address this critical mental health issue, I will outline the top 12 signs of depression in today's video, empowering you to recognize and take action against this silent threat. First, persistent sadness or a feeling of emptiness is a hallmark sign of depression. This isn't just a fleeting feeling of sadness but a profound sense of despair that lingers and affects daily life. Individuals might describe it as feeling emotionally numb or having a sense of impending doom, and these feelings are often persistent, lasting for weeks or even longer. This deep and unrelenting sadness often makes everyday activities and responsibilities feel insurmountable, adding to the sense of burden and helplessness. Second, loss of interest or pleasure in activities once enjoyed is another key indicator. This can include hobbies, social activities, and even a general disinterest in life events. Activities that used to bring joy or excitement might no longer do so, leading to a withdrawal from previously enjoyable experiences. This loss of interest can significantly impact personal relationships and social interactions, often leading to isolation and a further decline in emotional well-being. Third, changes in appetite and weight that are not linked to dieting can be a symptom of depression. Some people experience increased appetite and weight gain, while others may lose their appetite and experience weight loss. These changes are often significant and can be either a source of distress or go unnoticed by the individual suffering from depression. The fluctuation in weight and appetite can also contribute to a person's self-esteem issues, reinforcing negative feelings and perceptions about oneself. Fourth, sleep disturbances, including insomnia or oversleeping, are common in depression. Difficulty falling asleep, staying asleep, or waking up much earlier than usual can be signs of insomnia, while others might find themselves sleeping excessively, finding it hard to get out of bed, and feeling fatigued throughout the day. These sleep issues not only exacerbate the fatigue and lack of energy characteristic of depression but can also impact cognitive function and emotional regulation. Fifth, feelings of worthlessness or excessive guilt are often experienced by those with depression. They may harshly criticize themselves for perceived faults and mistakes. This symptom can manifest as a persistent belief that one is worthless, unlovable, or incompetent, and it can severely impact one's self-esteem and sense of self-worth. The constant internal criticism and self-blame can create a cycle of negative thinking that's difficult to break without help. Sixth, difficulty concentrating, making decisions, or remembering things is a common cognitive symptom of depression. This might manifest as trouble focusing on tasks, forgetfulness in daily activities, or indecisiveness even in small matters. This cognitive impairment can affect work performance, academic success, and the ability to manage day-to-day activities. It can lead to a sense of frustration and inefficiency, further lowering a person's confidence in their abilities. 7th, physical symptoms such as headaches, digestive issues, or chronic pain that do not respond to standard treatment can be signs of depression. Often, these physical symptoms are resistant to treatment or cannot be explained by other medical conditions, and they can significantly impact the quality of life. These symptoms can be misleading, leading to a focus on physical health while the underlying depression goes unrecognized and untreated. 8th, loss of energy or increased fatigue, even when not physically straining, is frequently reported in depression. Individuals may feel generally slowed down, or experience a sense of being physically drained, which can make even small tasks seem challenging or overwhelming. This pervasive lack of energy can contribute to a cycle of inactivity and withdrawal, exacerbating other symptoms of depression like isolation and weight gain. 9th, irritability or restlessness can be more prominent in some individuals with depression, especially in children and adolescents. This might manifest as a short temper, agitation, or an inability to relax, and can often lead to conflicts in personal relationships or issues in the workplace or school. This heightened irritability can make it difficult for others to understand or support the individual, leading to strained relationships and increased feelings of isolation. 10th, thoughts of death or suicide attempts, are serious signs of depression and require immediate attention. These thoughts can range from a preoccupation with death or dying to concrete plans for committing suicide. Any such thoughts or behaviors should be taken very seriously and addressed with urgent medical intervention. It's crucial to understand that these thoughts are a symptom of the illness and require compassionate, professional treatment. 11th, a decrease in physical movement and speech, observable by others, can be a sign of severe depression. This might manifest as speaking in a monotone voice, moving slower than usual, or having a noticeable lack of facial expressions, and can be a sign that the depression is affecting one's physical state and behaviors. This psychomotor retardation can further contribute to a person's social withdrawal and difficulties in carrying out daily activities. 12th, feelings of anxiety or excessive worry that are persistent may also be a part of the depressive syndrome. Though often seen as a separate condition, anxiety can co-occur with depression, manifesting as constant worry, nervousness, or being on edge, further complicating the treatment and management of depression. This coexistence can make it harder to diagnose and treat depression effectively, as symptoms of anxiety and depression can overlap and interact. Recognizing the signs of depression is the first step towards seeking help. If you or someone you know is exhibiting these symptoms, it's important to consult a healthcare professional. Depression is a medical condition that can be effectively treated, but early intervention is key. A healthcare provider can conduct a thorough evaluation, which may include a physical examination, interviews, and questionnaires to assess the presence and severity of depressive symptoms. Treatment for depression typically involves a combination of medication, such as antidepressants, and psychotherapy. Antidepressants work by balancing certain neurotransmitters in the brain that affect mood and emotions. While these medications can be effective, they may take several weeks to start working, and finding the right medication or combination of medications can require some trial and error. Psychotherapy, or talk therapy, is another vital component of treating depression. It provides a safe space to explore feelings, thoughts, and behaviors, and to develop coping strategies. Cognitive behavioral therapy, CBT, is particularly effective in treating depression, as it helps individuals identify and change negative thought patterns and behaviors. Lifestyle modifications can also play a significant role in managing depression. Regular physical activity, a balanced diet, adequate sleep, and stress reduction techniques can all contribute to improved mood and overall well-being. Additionally, support from friends, family, and support groups can be invaluable in the recovery process. Depression is a common condition, affecting millions of people worldwide. However, it's important to remember that depression, even in its most severe form, is treatable. With the right treatment plan, most people with depression can improve and return to enjoying their lives. To further help those struggling with depression, let's explore 8 lifestyle modifications that can complement medical treatment and promote recovery. These modifications range from dietary changes to stress management techniques, each playing a part in fostering mental health and resilience. Engaging in regular physical activity is a powerful tool in combating depression. Exercise releases endorphins and other natural brain chemicals that can enhance your sense of well-being. It also can take your mind off worries, help you gain confidence, and provide social interaction. Start with activities you enjoy, such as walking, dancing, or yoga, and aim for at least 30 minutes of exercise most days. Even short bursts of activity can make a difference in your mood. A balanced diet plays a crucial role in managing depression. Foods rich in omega-3 fatty acids, such as salmon, flax seeds, and walnuts, and those rich in folic acid, like spinach and avocados, can help ease the symptoms of depression. Eating a diet high in fruits, vegetables, whole grains, and lean protein can provide a steady supply of energy and nutrients, enhancing overall mood and energy levels. Avoiding alcohol, caffeine, and processed foods can also be beneficial, as these can negatively affect mood and energy levels. Establishing a regular sleep schedule is essential for mental health. Sleep and mood are closely connected. Poor or inadequate sleep can cause irritability and stress, while healthy sleep patterns can enhance well-being. Create a relaxing bedtime routine, avoid screens before bed, and make your bedroom a comfortable, sleep-friendly environment. Aim for 7 to 9 hours of quality sleep per night. Stress reduction techniques such as mindfulness, meditation, and deep breathing can significantly impact mood and anxiety levels. Practices like mindfulness can help you focus on the present moment and break the cycle of negative thoughts that often accompany depression. Setting aside time each day for relaxation and stress management can improve mental health significantly. Social support is vital in managing depression. Isolation can exacerbate symptoms, so it's important to connect with others. This could involve spending time with family and friends, joining a club or group, or participating in community activities. Even small steps like engaging in daily conversations can provide significant emotional support. Journaling or expressive writing can be a therapeutic way to handle depressive symptoms. Writing down thoughts and feelings regularly can help you understand your emotions, identify patterns or triggers in your life, and provide an outlet for expressing what you're going through. This practice can bring a sense of relief and perspective. Engaging in hobbies or activities that bring joy can be an effective way to combat depression. These activities can provide a sense of accomplishment, enhance creativity, and offer an escape from the routine stressors of life. Whether it's art, music, gardening, or reading, dedicating time to activities that you enjoy can be uplifting and therapeutic. Practicing gratitude can shift the focus from negative to positive aspects of life. Keeping a gratitude journal or simply taking time each day to reflect on things you're thankful for can help cultivate a more optimistic outlook. This practice has been shown to improve mood and foster a greater sense of overall happiness. Implementing these lifestyle changes can significantly aid in the management of depression. While they should not replace professional treatment, these modifications can complement medical interventions and contribute to a holistic approach to managing mental health. Remember, taking small steps towards a healthier lifestyle can make a profound difference in coping with depression. In summary, depression is a complex and often debilitating condition, but it is also highly treatable. Understanding and recognizing the signs of depression is critical for early intervention and effective management. Untreated depression can lead to severe consequences, including worsening of symptoms, increased risk of substance abuse, physical health problems, strained relationships, and in severe cases, suicidal thoughts or actions. It's important to remember that depression is not a sign of weakness or something that can be overcome with willpower alone. It requires medical attention and a comprehensive treatment approach. The intersection of depression with other medical or psychological conditions underscores the importance of a thorough evaluation. Coexisting conditions like anxiety, substance abuse, or chronic health issues can complicate the diagnosis and treatment of depression, making an integrated treatment approach essential. Advancements in medical treatments for depression, such as the development of new antidepressants and therapies like cognitive behavioral therapy, CBT, and interpersonal therapy, IPT, have greatly improved outcomes for many individuals. These treatments focus not only on relieving symptoms but also on addressing underlying issues and teaching coping strategies to manage stress and prevent recurrence of depressive episodes. Historically, approaches to managing depression were limited, and the condition was often misunderstood. Today, increased awareness and understanding of depression have led to better recognition and more effective and compassionate treatment options. The stigma surrounding mental health issues has begun to diminish, encouraging more people to seek help. In addition to medical treatment, lifestyle modifications play a crucial role in managing and recovering from depression. Regular exercise, a healthy diet, adequate sleep, stress reduction, and social support are all key components of a holistic approach to treating depression. These lifestyle changes can help improve symptoms, boost overall health, and enhance the effectiveness of medical treatments. Education and awareness about depression are crucial in breaking down stigma and promoting early intervention. Understanding the signs and symptoms, knowing when to seek help, and being aware of effective treatment options can empower individuals to take the first steps toward recovery. Depression can be a challenging journey, but with the right support and treatment, recovery is possible. It's essential to approach treatment with patience and compassion, as recovery can take time and may involve some trial and error to find the most effective strategies for each individual. Remember, if you or someone you know is struggling with depression, reaching out for help is a sign of strength. There is hope, and many resources are available to support you on the path to recovery. To learn more about this topic, please like the video and subscribe to my channel. I send my best wishes for you to always be safe, prosperous, and happy. Please remember, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns.